The heart is a remarkable organ, a tireless pump that circulates blood throughout our bodies. It has 4 chambers, 2 on the right and 2 on the left, each playing a crucial role in this circulation process. In some individuals, a hole can be present in the wall separating the atria, a condition known as Atrial Septal Defect or ASD. This hole can allow blood to flow abnormally between the atria, potentially leading to health complications. Understanding ASD, its causes, and potential implications is crucial for both patients and their families. Atrial septal defect manifests in different forms, each with its own characteristics and potential implications. The most common type is the ostium secundum ASD, occurring in the middle portion of the atrial septum. Another type is the ostium primum ASD, located lower down in the septum, often near the heart valves. Sinus venosus ASD, a rarer form, occurs near where the large veins enter the right atrium. Coronary sinus ASD, the least common type, involves a defect in the wall separating the coronary sinus and the left atrium. The type of ASD influences the potential complications and the need for intervention. The formation of the human heart during pregnancy is a complex process. Any disruptions during this period can lead to congenital heart defects, including atrial septal defect. While the exact cause of ASD remains unknown in most cases, research suggests a combination of genetic and environmental factors might play a role. Genetics can predispose an individual to ASD, especially if a close family member has a history of congenital heart defects. Environmental factors during pregnancy, such as exposure to certain medications, alcohol, or maternal illnesses, can also influence fetal development. Despite ongoing research, the cause of ASD in many cases remains a mystery. While atrial septal defect can affect anyone, certain factors can increase the likelihood of a child being born with this condition. Family history of congenital heart defects, including ASD, is a significant risk factor. Genetic syndromes, such as Down syndrome, Noonan syndrome, and Holt-Oram syndrome, are also associated with a higher risk of ASD. Maternal health during pregnancy plays a crucial role in fetal development. Uncontrolled diabetes during pregnancy can increase the risk of various birth defects, including ASD. Maternal infections, especially rubella, during the first trimester can also disrupt fetal heart development. Certain medications taken during pregnancy, such as some anti-seizure medications, have been linked to a higher risk of ASD. Detecting atrial septal defect often involves a keen ear and specialized medical equipment. The most common sign of ASD is a heart murmur, an extra or unusual sound heard during a heartbeat. This murmur, caused by turbulent blood flow across the hole in the atrial septum, can be detected using a stethoscope. If a heart murmur is detected, further tests are necessary to confirm the diagnosis and determine the type and severity of ASD. An echocardiogram provides detailed images of the heart's structure and blood flow, allowing doctors to visualize the ASD and assess its size and location. While preventing atrial septal defect entirely might not be possible in all cases, certain measures can significantly reduce the risk and manage the condition effectively. For expectant mothers, regular prenatal care is paramount. Controlling pre-existing conditions, such as diabetes, and getting vaccinated against rubella can significantly reduce the risk of congenital heart defects. Avoiding alcohol, smoking, and illicit drugs during pregnancy is crucial for healthy fetal development. For individuals diagnosed with ASD, the approach varies depending on the defect's size, type, and symptoms. Small ASDs might close on their own during childhood and require no intervention, but regular monitoring is essential. Larger ASDs or those causing symptoms might require closure procedures, typically performed by a pediatric cardiologist. Atrial septal defect, a hole in the heart's wall separating the upper chambers, underscores the intricate complexity of human development. Understanding the different types of ASD, their potential implications, and the available diagnostic tools is crucial for both patients and healthcare providers. While some ASDs might be benign and require no intervention, Others might necessitate procedures to prevent complications and ensure optimal heart function. Prenatal care, healthy lifestyle choices, and timely medical interventions are crucial for managing ASD effectively. Regular checkups with a cardiologist, even after successful closure, are essential for monitoring heart health. Advances in medical technology and our understanding of congenital heart defects offer hope for improved diagnosis, treatment, and long-term outcomes for individuals living with ASD.